Krista Lucchesi comes to us from the Mercy Brown Bag program, and she collaborates with 90 Alameda County senior service agencies as a director since July of 2008. Prior to that, she worked in administration and development at St. Anthony Foundation and Juma Ventures, both San Francisco nonprofits. She holds a Master of Nonprofit Administration degree from the University of San Francisco and is an active member of St. Paul Lutheran Church in Oakland. She is a 2021 graduate of Leadership Oakland through the Oakland Chamber of Commerce and serves on the Alameda County Community Food Bank Board of Directors and the Alameda County Emergency Food and Shelter Program Local Board. Everyone, please give a warm welcome to Krista. Yay!
Thank you all so much. I'm so excited to be with you. I'm going to share my screen here and hope that it works. Yay! So thank you again, and I will jump right in. So excited to introduce you to the Mercy Brown Bag program right here in the Fruitvale district, and super excited to partner and tell you more about it. So a quick word about our history. About 40 years ago, the residents of Mercy Retirement and Care Center met their neighbors here in Fruitvale and saw that they were hungry and decided they wanted to do something about it. So they'd knock down the doors of the stores that are right around here and some bakeries, and they put together some bags. They started with about 30 households. And then we started to grow when the California Older Californians Act was passed. They decided that they wanted one organization in each county to serve all the seniors. And so they chose Mercy Brown Bag program. Usually all of the counties around us, it's the food bank, but we actually are older than the food bank. And we were already serving seniors, and so they chose us, and so we're kind of the senior arm of the Alameda County Community Food Bank. We partner with them, and so we spread out. So that we started with churches and senior centers, and then affordable housing buildings, that we would make sure that we brought groceries to those places. We would go inside, bring it and set it up on the tables, and then the residents or the people from the community would come and gather. We love the socialization, we love the exercise of being together, and we especially love the volunteers that really were the people in the line as well. So we would have seniors helping seniors, and it was really beautiful in all of these different places when all the seniors could gather together and get their bags. They would either shop from the items that were laid out on the tables, or else volunteers would build the bags, and then they would take a bag. In 2017, we added this mobile truck to our to our program, and you can see the shelves that pop out of each side of the truck, and this way we can bring food to the outside of the buildings, go into neighborhoods where people are, and then invite them to come and walk down the side of the truck and shop for the food that they need. So that just happened in 2017, and then of course we had the pandemic, and no longer did we want the older adults to gather together, so we overnight figured out how to home deliver groceries. It was quite crazy, and we figured it out eventually. It's quite a system now, but we are really excited that we'll be able to go back to gathering hopefully soon. We're watching all of the news and making sure we make good decisions about when we invite everyone back. But this is also when we're launching the grocery store that we talked about just a bit ago. Because at Mercy Retirement and Care Center, There was never a place where we could lay out tables, put out the food for people to shop. So they always received just a bag of groceries, and that's not my preferred way. So the grocery store is a way that we finally have a room that we'll set up as grocery style, and people will be able to come pick what they want. They won't have to come and remember, is it first and third Friday? They can come whenever they want, when they need food, and get what they need. So we're super excited about that. And there's even a vending machine pilot that we're going to try out in the coming year to see if we can have groceries available 24/7 instead of just twice a month at a building, and see if that works. So you'll hear more about that later. So I always like to start with why. Why balanced nutrition? Why is this important in our community? And really the consequences of hunger for older adults are pretty staggering. Lots of research has been done. One of them that I like to quote is that a 64-year-old senior that's suffering from hunger is likely to have the physical limitations of a 78-year-old. So you can see it really makes a huge difference in their quality of life. The cost effectiveness of our program is like 1/10 of just one day in the hospital that we can feed the seniors for the entire year. So it really is a great investment. And this really helps them to stay independent. We love our older adults and want them in our community. It makes the community so much brighter. And this is a way to help with the expenses, to keep people in their homes and keep them here in our community, keep them independent. And really, it relieves a lot of stress. One day someone told me, if everything goes okay, I'll have $1.87 at the end of the month. And you know, it never always goes okay. So this is a way to help people stretch their dollars, relieve some of that stress of everyday decision making, and be able to have the nutrition they need to stay healthy. And we gave over 2 million pounds last year, and we have over 114,000 bags that got home delivered throughout the year. So you can see, you know, it's making a big difference, but there's still a lot to come, a lot of need out there. And this shows you a little bit about how we serve. I talked a bit about it, but down here is the inside distributions where we bring the food in and people come and shop. And then this is the mobile grocery truck from a different angle where you can see people shopping. This is our warehouse at Chapman where we make the bags. We had to rent that space so that we could keep our volunteers 6 feet apart. And then this is one of our volunteers delivering it. And then the grocery store, as you can see, is very empty. That's why we need you. We have some shelves and we have some raised garden beds is what we're going to use to display some of the produce for people to shop. And that's the room, and it'll soon become much better than that. So who do we serve? 3 criteria: if you're 60 years old or older, live in Alameda County, and have a limited income. So for us, the limited income is set by FEMA and USDA. And for one person, a monthly maximum is $2,522. For 2 people in the household, it's $3,411. And 3 in the household is a maximum each month of $4,300. But I'll say that the majority of our folks are nowhere near that amount. Most of them receive SSI and SSP, which means that their income is somewhere around $950. That's what they're trying to live on in the Bay Area. These 3 little haikus are a way that I figured out how to try to condense some of the phone calls I've gotten over the years. And you can read them there, the little 18 syllable stories that are from actual phone calls I've gotten. A couple other ones really, one person told me, people say 60 is not old, but I so wish I died 10 years ago. And it just broke my heart that it was so hard to live, that was the reality for that person. And another person called to say that cake's all that was left. You do not know what this means. The only thing left. So those are just little snippets of some of the stories and some of the people that we're serving, and why it matters. And so that really leads me to senior poverty, to talk about that for a minute. It's not the only reason that people are food insecure, but it really does have a lot of links. And you can see the statistics here of what people are trying to live on and how many Americans this is affecting. After hearing all of those calls for all of these years, I've been with the program for 15 years. I, at some point, decided I was going to burn out if I didn't figure out a way to kind of help raise awareness and advocate and see if we could get partnerships to begin to solve this issue for so many people in our community. Many of these people will live another 2, 3, 4 decades more, and we want that life to be full and rich, and to have them in this community to be able to enrich everyone. All of this is really also compounded by age discrimination. The pandemic saw a lot of people who had unplanned retirements, and that means less years of savings, and there's fewer job prospects. It takes longer for older adults to get a job, and all of those things really add up to some trouble in people's lives. And also, people think that they're immune to this, that when they become seniors, they're not going to have to deal with any of this. But the reality is that a lot of health costs or loss of a spouse, rejections because you're overqualified, different things happen. And we've heard lots of stories about how the older adults in our communities are struggling, not what sometimes you'll hear on the news why people are poor, or you'll have people try to tell you, but it really is a lot of life circumstances that happen. And if businesses and nonprofits, media, government leaders, if they step up and really speak out and spend some of the money that's needed to address this growing problem, I think that that's really going to end the suffering by raising that awareness, and having this really be part of the national conversation. So I'll get off of my soapbox a minute, but that's a way that I feel like we can be a part of the community, is helping more than just food. So here's a map that the Alameda County Community Food Bank put out. And this was from before COVID, right? Where you can see all of the food insecurity rates. And you see all of those red are also very similar to, in November, the case rates in Alameda County. It really does affect people's lives in many ways. This is the numbers for Oakland. This was from the 2019 American Community Study Census that the census puts out. And They say about 10,700 older adults, that's 65 and older, are living below the poverty line. And I'm not sure if you know what the poverty line is, so I'll just tell you quick. It's kind of like you were making $6 an hour or $12,880 a year. So there's that many people, that's for a household of one, but that's that many people that are living below that in Oakland, and you know how expensive it is here. The government does use kind of an extremely conservative measurement for poverty level, and it really kind of minimizes the extent and the depth of poverty. I don't think that we can really address it unless we have a really clear understanding of its scope and the real number of people that qualify for other state and federal assistance. And I think if we ever hope to finally win the war that LBJ began in 1964, the poor really need to be seen in order for those for the government to help lift them out of this. We're at 52 different locations in the city, 90 overall in the county, and everyone gets the food free of charge. It's about a 20-pound bag of food twice a month and all year long. Then another piece that we feel like we're making a difference is in the social isolation. So during COVID, we made sure we were calling people. We had volunteers that were making phone calls, connecting with people, seeing if they needed things, giving them resources. And this particular study with the 15 cigarettes, other people have kind of debunked that at this point, but there is substantial evidence that having a lack of social connections significantly, like 30 to 40%, increases the risk of premature mortality. So it's a huge public health concern. There's a organization in the UK called the Campaign to End Loneliness, which I just think is so beautiful. And one of their taglines is, "No one should have no one." And we really try to infuse that into the program and try to make the connections and have the drivers talk with the seniors when they get the bags, and certainly when they're gathered, try to make it a place where people can connect. It really does lead to more cognitive decline and depression, has all kinds of predictiveness of suicide in older adults, or blood pressure, reduced immune functioning, lower self-esteem, all kinds of things are because of that. So we're seeing that the pandemic really did take a toll there. These are two quotes, testimonies that we had recently. So getting the fresh fruits and vegetables really is encouraging, motivating them to cook, and eating that fresh fruit every day. And eating the greens and getting some new vitality these are all amazing pieces of the puzzle. I wanted to tell you also about Walter, who's here in this picture. Walter was a volunteer with us for about 20 plus years. And in that time, he had, I think, 7 bouts of cancer, various different cancers in his body. And he would go for treatments and tell the doctor, "I have to have the morning slack because I have to go to work." And he would bring me a work slip every day. And I really believe he's the epitome of the science that says that volunteering keeps people alive 10 years longer. He was absolutely, vital in our program. He would come every day, and he made the lives of those around him amazing, but the job of volunteering made his life so much richer and fuller. And that's the embodiment of seniors helping seniors that we have on top of groceries. And oops, my little thingy isn't working. There you go. So this is the cost of running the program. The full budget is about 5.3 million next year. We get that through individuals, corporations, government, foundations. But the real magic of Mercy Brown Bag is that 4.1 million of that is all donated. So it's the food, the volunteer hours, the fact we don't really pay for the space here at Mercy Retirement and Care Center, the back office support through Elder Care Alliance. They do all the finances and HR and IT, all those things. So we don't have to raise money for those things. So the dollars really go right into the program. That means that each bag costs us about $10.50, and to feed someone for the entire year is about $250. Some people spend that just one grocery trip, but we can feed someone with that 20-pound bag of groceries twice a month all year for the same amount. And I saw on your website the people of action part, and I love that. And so I wanted to say, like, if these are things that you want to partner with us or can, referring older adults, definitely, if you know anyone in your life that is struggling with any kind of food, please send them our way. And tell your networks. We really do want to raise the story of that this is happening. I think it's a hidden problem sometimes. And if you want to volunteer, we have that just coming right up if you want to help us build out that store. But also we have other opportunities that are on the website. If you want to donate food or have a food drive or a bag drive, we can always use paper bags or funds. And then, of course, advocating for all of the different pieces of the puzzle that make life better for our community, make life better for the people that we serve as well. So I wanted to share in the food bank's recent report that they did with the Urban Institute. They talked to some of the seniors, and some of the quotes that they said, they were saying that being unable to access food is extremely stressful and it can be humiliating. This focus group of seniors said, sometimes you think this is it, this is the way it's going to be, there's no way out. And another added, it makes you feel like you're less than. And so I feel like my exposure with people in the Rotary, that's not how you ever want to have your community members feel. And so if you want to partner and help us to make sure that the seniors feel welcome, please come help with making the store feel welcome, and any other ways that you feel moved to help is all welcome. So that's my presentation, and here is some of the contact information if you are interested, and then I can take questions.
Awesome. Thank you so much, Krista.
You're welcome.
That was wonderful. Oh, Lisa, go ahead.
Well, if I understood you correctly, you said that you can help like 1 out of 5 of the people in the county that are below the seniors who are below the poverty line. What about the rest of them? When you're saying refer people to you, how many can you handle?
Such a great question. So we are not the only organization that feeds people in the city. Ours is focused on older adults, but there are lots of other places, churches, all kinds of other nonprofits that also feed. So because we serve that much in Oakland, that doesn't mean that the others aren't being served at all. The other piece, I think, is that there are people who are living below the poverty level, but they have other assistance from their families. So the census shows that there's this number, but they do have some food resources and don't really need the help of groceries. The other piece is as people age, their needs for food change. And so when you're still able to get out and cook for yourself, it's great to get the groceries. But maybe you can't cook for yourself anymore. And so then you maybe go to the congregate meals. And as you age even more, you may become homebound where you can't even get to the congregate meals. And so then you would get Meals on Wheels. So some of those people are accessing the food, but in a different format than just groceries.
Do you have a sense of how many aren't being served at all?
So that's a big question that the Alameda County Community Food Bank, they have the research team that's really been trying to see, and they put out a study just recently, again with the Urban Institute, where they were trying to find the holes, trying to find out what it is. And where I believe, and what I've been trying to get to, are the folks that live in their own homes, that they maybe have lived there a really long time. And so even though they're, living below poverty, they still have their own homes. So they don't have the same resources that people who live in affordable housing buildings have. And so those are the places that we're trying to reach, which is why we have the mobile truck, to be able to go into neighborhoods, go to places and get closer to folks so they can walk to us and be able to get the groceries that they need. But I don't know the exact number. I wish I did. I think COVID helped. We added 2,000 people that called during those months. So I think that the word got out when people really felt the need. And I believe that that's a good step in the right direction.
Thank you.
So Krista, if I can ask, so the events that we're trying to schedule for the 24th or the 25th, are we trying to help you set up to open your grocery store? So putting up shelves and tables and that kind of thing? Is that what we're talking about that day?
Yep,
okay.
That's what we need. We just haven't been able to get to it, and we wanted to have a soft opening that last week of July to kind of see how long does it take someone to shop and how many volunteers do we need. But we are having time troubles to actually get the shelves up and put the food on it and make it look like a grocery store. Gotcha. So that's what you would be helping with, shelves and stocking the shelves.
And did I understand you correctly that you really need paper bags? Because during that whole COVID time when they wouldn't let you bring your own bag into the grocery store, I have accumulated a rather large collection of paper bags that I would be happy to get rid of.
Yes, yay, okay. That's wonderful. Yes, we go through about 2,000 bags every single week. So it's very expensive. So we are always looking for paper bags. And you can drop it off at Mercy on 34th and Foothill at any time because we have a receptionist 24/7. Wow. So always welcome. Cool. Thank you.
You actually meant to say donate, not just get rid of.
Yes, they're all in fine shape and quite usable. Yeah.
Perfect.
For the quotation that you had in terms of the cost per person to feed them for a year, do you, in your attempt to raise funds for that service, do you associate it with who a person is helping? In other words, sometimes like Care International has, here's the child kind of thing. Do you personalize those contributions?
We have not in the past, and I think part of that is that feeling of, what's the word they used in the humiliating was the word they used in that study, that sometimes it's a bit of a burden for folks to say that they can't provide for themselves. And so this, we haven't really personalized it with a name and a face in the past, mostly for kind of that piece of honoring them. So
sensitivity,
That's fair.
yeah.
the dignity. Yeah.
I kind of wanted to follow up on one when we were talking about potentially volunteering. You kind of had mentioned there was the opportunity to manage the store, or like kind of, but like it might work for our hours. Can you speak a little bit more about what that kind of volunteer work would look like?
Sure. So we're trying to keep the store open about 16 hours during the week in order to give everyone access to the store when they need it, and try to minimize some of those long lines that they've had to stand in the past. And so we have 4-hour shifts basically, and we split it into 2. And so we have 2 folks that are the first shift and 2 the second, is how we're setting it up now, to kind of run the store, check people in, see if they need help, restock, those types of things when they're shopping. And it's a really great way to show love to your neighbors. So if that's something you're interested in, definitely let me know. We're going to have a little training at the very end of this month. I think it'll be on the 26th. You've got lots going on right now, but even if you can't come to the training, we'll have volunteers that will train, and we'll be there to welcome new volunteers and kind of show them around as well. And you can sign up for any of those shifts, as well as any of the bagging or delivering shifts, on our website.
Yeah, I just wanted to mention my sister's been doing that for many years in Gloucester, Massachusetts. They have a food pantry, and you volunteer for 4 hours at a time and stock the shelves and give people what they are asking for. Yeah, works very well.
Yeah.
Where does most of your food come from? Does it come from Alameda County Food Bank, or does it come direct from producers, or where do you source things?
So the majority of it comes from the Alameda County Community Food Bank. They offer all of the produce for free, so it's really hard to beat that price. And that's, of course, what we want the most of for the bags, and what the older adults really want when they come. So we get most of our food from there. During the pandemic, because we added so many people, we were also purchasing directly from organizations. ePallet is the name of a place that kind of brokers with corporations. And so we would buy pallets of food to make sure that we had enough and had a good balance. Most of what we purchase is protein items, making sure they have really good quality, healthy, low-fat protein items, because that's just so essential to people's diet and is the most expensive thing. So the hardest for them to be able to get also. So we spend a lot of money making sure we have those items.
I did have one more question, because I know we had someone from SOS Meals on Wheels, Adrian Abuyan, come, and he kind of mentioned that they had partnered with the Mercy Brown Bag Program. Can you talk a little bit more about what that looked like and if that's continuing forward?
Sure. Yeah, it is. It's still continuing. It keeps growing. So because Meals on Wheels gives one meal a day, we realize that people don't have breakfast and dinner maybe, or breakfast and lunch, and they eat it for dinner. But we tried to give specialized bags for folks that don't do a lot of cooking. So these are easy to cook, low sodium, very healthy items that they can use for breakfast and for another meal of the day. And the drivers that take the meals twice a month, they will bring the food. That's how SOS Meals on Wheels does it right now. But another of our Meals on Wheels, they just add some of those items to the bags each time so that they kind of get food throughout the month instead of just in 2 increments. But it's things like protein bars for breakfast, oatmeal, cereals that are fortified, things like that. And then for the other meal of the day, there's like stews or all kinds of different things that are easy to eat that I'm blanking on right now, but proteins and other things. It's not a lot of produce because a lot of our produce needs some preparation, and it's harder when you're homebound. A lot of the folks don't cook for themselves anymore. So it's this partnership where we make sure that we're getting them the extra food they need if they're not able to get it themselves.
You know, Krista, when you talked about Meals on Wheels, many moons ago when I was with a Rotary Club in East County, we delivered Meals on Wheels 1 day a week. And I found, you referred to it as isolation, but I found the interaction was almost more important, the food for the soul, more than the food for the body. And I felt at times some of these individuals maybe saw one person a day, and it was the person that showed up from Meals on Wheels. I wonder if that was some of your experience, because it seems like your clientele might be a little bit more mobile.
So ours are a bit mobile, but I will say 100% that is what I hear from folks. With Meals on Wheels, any of the seniors that I've talked with, they'll tell me that it's the connection that makes the difference more than the meal. Although it's very helpful, it is that personalization, and for many of the reasons that I talked about before. So you're totally right. And during COVID, of course, when people are sheltering in place, we heard a lot of that. One of the stories goes that a volunteer called and talked to a woman for 40 minutes who just had to talk. And then she hung up and she called the next number, which happened to be that person's husband. And the husband is like, I don't really want to talk to you. And the woman is like, oh, is that her? And so she took the phone from her husband and talked for another 40 minutes. And we said, maybe you've saved a marriage. So people were very desperate to talk with people during this time. And I can't wait for people to be able to get together again, because it is a big part of them, keeping track with each other, seeing each other every couple of weeks. There's really strong community around each of the locations that we go to.
Just before we wrap up, curious, what's kind of been your current reopening plan, or what does that look like?
Yeah, so it's complicated because we have 90 different places to make it work. And we're 2 drivers down right now, so it makes it even more complicated. If anyone knows of anyone looking for a job, we're hiring a driver and distribution, taking food to places. But we, each of the places has a different plan. As you can imagine, everyone is at a different stage in how comfortable they are. So some of the buildings we have reopened and people are coming to. The senior centers, I believe they'll be opening in August. So we're getting geared up to be able to do that. And then some of the home deliveries, what we're doing is the ones that are close to the grocery store, like that are within the 94601 zip code, or maybe a few that touch it. Those people will be notified that they can come to the grocery store now instead of getting the home deliveries. And so we're notifying them the first week of August, and those are some of the people that will start to see trickle into the store. If they're not able to come to get their groceries, and they're or that they live a little further away, we're directing them when those places open to go to those different senior centers or the other places that they can get food. And we imagine we'll still have some that need those home deliveries. So we're working that out as we go to make sure that we can reach people as they're needed. And if they really are homebound, we'll partner with Meals on Wheels and see if we can get them groceries that way. We have an agreement with DoorDash, and United Way is actually paying DoorDash drivers to take our bags. And they said that they will continue paying for it till the end of December. So we're gonna see what how many people are really needing those home deliveries, and keep doing that until we can't any longer. And then we'll see if we can get volunteers to do the delivery routes after that. So that's how we're hoping to transition back to being able to gather. It is really important for people to gather. It's, like I said, the exercise, the socialization, the volunteering, all of those things are so good for their health, that we'll encourage as much as we can.
Perfect. Thank you. I really appreciate you taking the time to talk to us tonight. I'm going to transition over to share my screen. Armando's going to. You got this? Maybe? Seamlessly? I'll make sure. As a thank you for speaking with us tonight, Krista, we are going to be donating some vaccines in your name.
Yay! Thank you. That's awesome.
So we're donating polio vaccines.
Yeah.
Rotary's committed to ending polio now, and it's been something we've been working on as an organization for the past 30 years, and it's only endemic in Afghanistan and Pakistan. And so, I mean, we really appreciate your time and wanted to show our gratitude in this way. And
that's awesome.
Yeah, we're looking forward to working together. I think, helping set up the space, especially a place where people can gather, is exciting. And, that's kind of our thing.
Very us. Yeah.
Yes. Thank you.
Rotary.